see about how to prepare for nursing officer entrance exams in Norcet, aiims, Jipmer, PGI Chandigarh, ESI, Nimhans, and other central and state institute. For any exam, it is very important step is to analyze the syllabus and understand the syllabus first. So most of the exams in India, around 70 to 80% of the questions will be asked from nursing subjects, and the remaining 20 to 30% will be general knowledge, general English, and general aptitude. And nowadays, most of the exams in Jipmer are two level. One is entrance exam, and another is skill test. Skill test means is only just pass or fail exam only. Even if you scored first rank in entrance, if you are failed in skill test, you will be disqualified. So very important is to pass the skill test. Those who studied BSc nursing properly can clear the skill test easily. Coming to nursing subjects, around 40 to 50% of the questions are asked from med-surgical nursing. All we know, med-surg is the most important topic in nursing. So most of the work we are doing in ward or OT or anywhere, it's related to med-surgical nursing only. So it is important to study the med-surgical nursing very properly. So important topics we have to cover very properly. For example, full data rates we have to understand and rate APG analysis, drugs, cardiac drugs, everything we have to understand and read properly. Come to obstetric gynecology nursing, labor process, stages, everything you have to study properly. Around 10 to 20% of the questions will be asked from this topic. Fundamental nursing, all we know, it is first step in the nursing. Fundamental nursing means IV administration, bed care, IV administration, bed care, and positioning. Everything will come under fundamental nursing. Though that under you have to do good work. Coming to mental health nursing, around 5 to 50 questions from this topic. If you are attending Nimhans exam, it will be more. Coming to community health nursing, it will be 5 to 15 percentage. If you are studying N class question paper as a N class books, you will not be covered community health nursing. So we have to give consultation, and those who are studying only N class books like Sanders, they have to give consultation for community health nursing. Coming to child health nursing, it is only 1 to 5 percentage. Mostly immunization, some common diseases only asked from this topic. Basic nursing, each and what are the important topics will be covered differently from each topic in a different video. Coming to basic nursing, anatomy and physiology, psychology, sociology, pathology, genetics, microbiology, this will be asked 0 to 10%. Sometimes they will ask more questions, sometimes they will not ask even a single question. Coming to nursing education, nursing research, nursing administration management, it is 0 to 5%. But for clinical instructor and tutor, it will be more than 20%. So based on the exam, it will varies. So this is a overall idea of how the questions will be asked from each topic. Coming to general knowledge is the most important topic in other subjects. It's a 25 to 40%. Questions like where is Chilica lake present, where is Archimede present? It's a last year Jipmer question they asked, this Archimede Lufthansa where is present, that kind of questions. The general knowledge is a vast one. We cannot think that these questions will be asked, but for overall idea there will be some books like Ariane book, Lucient. These are the books. Like a story book, we can read these two books. Any one of the two books. Okay. This will help you to clear the general knowledge. Around, if you are reading these books, almost you can clear 20% of these questions. 20%. Suppose you are asking 5 questions, you can able to answer at least 3 questions. But if you have to consider current affairs also. What your daily day-to-day living is called current affairs. If that may be occurred through newspaper or through news channel. Coming to general knowledge, general English, around 20 to 30, 25% will be asked. This will be up to 10th standard only. So it will not be quite difficult task, you can clear it very easily. General aptitude and arithmetics, this plays very important role, because uh, in 4 years of nursing we are not studying max and all. Only for drug calculation we are studying, otherwise we are not doing anything. So the questions will be like LCM, HCF, simplification, uh, number orders, that kind of questions will be asked. So you can work for some questions will be like 10 members are doing this work for 10 days. how many how many how many days it takes for 7 members? Okay, this kind of question, there is a formula for there is a way to derive formula for this kind of question that I will discuss you in separate video. Skill test, pass or fail. It is a pass or fail, I already told it is around 4 to 10 station will be there, 1 minute for each station. And this will be easy only. For example, they will ask any important nursing procedure, assess pulse, give IM administration, um, assess different type of pulse, give administration to the IV administration, IM administration, how will you give subcutaneous injection, how will you do CPR, how will you take APG, and how you do Allen test, like that kind of the simple questions they will ask from procedure. For equipments, they will ask maybe where they find it is a spirometry or the spirometry or infusion pump. That kind of simple question will be there. If you will be, if you are oriented to ward and everything, it will be easy. Anyway, I will cover what are the important topics of skill test later. Just I'm giving you how you have to approach. Instruments means OT instruments like a mosquito, Spencer well, Robertson, ovum forceps, um, arm forceps, lung holding forceps, that kind of simple towel clips, sponge holder, that kind of simple questions only they will ask. Okay, mm, and that's all. Coming to method of preparation, for any method, it varies according to the self preparation. Always, if you are doing self preparation in a good manner, it will be good actually. For this, everyone need time planning. It is very important. Time planning, no procrastination. If these two are correctly managed, then you can clear any exam. Okay, for that, first step is selection of books and materials, analysis of past year question paper. This is very important, because even if you're studying books, you are not, if you are not approaching the questions, you may not have a good idea how to approach the questions. So it is very important to analyze a past year question paper. That will gives you idea where the important questions are asked and how they have asked. Even if you know the answers for some question, during the exam time you will not be you're not able to answer the question, because you are not uh, exposed to the questions previously. So for that, you need to analyze the question paper, first year question paper, how they asked. That will give a good orientation for you, orientation to the question paper. Okay, then practice more question. Practice makes you perfect. That is a mantra. Okay, so more questions you are practicing, more knowledge you are gaining, so more chance of getting qualified for the exam. Notes taking and revision is also important. It is up to you to take notes and revision, but revision is important. For that you need notes, so it is up to you. But if you want to get passed, it is important to take notes and revision. How will you do notes? For example, if you are studying ABG, okay, what is metabolic acidosis, metabolic alkalosis, and respiratory alkalosis, metabolic alkalosis, and here pH value, CO2 value, HCO2 value, O2 value, PO2 value, okay, and base. these are the things you should be thinking. These are a value of metabolic, is it positive, negative, like that kind. It should be like a single paper in a single short notes. If you see that question, if you see that notes, you will be able to understand what is in it. Okay, so simple type of example. And another topic is fluid and electrolytes. You have to take sodium, increased, decreased. So symptoms will be there, ECG changes will be there. That kind of symptoms, what is the symptoms, what are the ECG changes. Okay, and range, this is a range 135, below 135. So then potassium, then calcium. So like this you have to take notes. Okay, it will be easy to take that. Then selection of books, any N-class books, that means Saunders, Mosby, Davis, anyone is okay. It is up to you to select which book is apt for you. Mosby is content in Mosby is more compared to Saunders, and Davis is somewhat older, but it's a good book. Any one book of Indian author, it is important to uh, study any Indian author book also, because they will not cover community and Indian setup questions, immunization, everything they will not cover properly. Okay, it is because it is an international standard, so we need to follow any one of Indian standard. I like to recommend you Darker Tie. It's a good book. Key to success Sura nursing exam. Any book which suits for you, you can select. But Darker Tie somewhat was better. And if you have free time, you can do any work. For example, if you are traveling, suppose you are stressed up with books reading, you can do practice by using any standard apps from Google Play Store. These are the some standard apps, GK for Success, Nursing, Exam Nursing. There are a lot of apps. I am not recommending any apps. Just you go through that apps and you can get exposed to that. GK for Success is paid app, but it is a good. Okay. Practice more question, and